health, you've been a former Minister for Health. We've got hospitals still running short of beds. CWM Maternity Hospital, the extension still not done. Shortage of medicine, the shortage of basic equipment. It has been said that this is because of the dilapidated infrastructure and neglect from the past. What do you have to say to that?
Well, yeah, medicine is still running short. This government came in promising that, hey, we're going to come in and all of a sudden these things will be fixed. They promised the same thing about the state of the hospitals, the operation theaters, the knobs on the doors and all of those things. Those things are still there. So what does it tell you? There's no quick fix. Something that has to be done systematically. We have to deal. No, in the hospitals, you know, these light bulbs disappear. Even the starters for the tube lights, they disappear. Cutlery disappears. That happens all the time. And you make a repair to the toilet, within 1 month or 2 months it's broken again. These are challenges that you meet every day. So it's what I was saying, that when you are government, you do the best that you possibly can. You do your planning, you do your implementation, you do your review, and you keep improving. And when you come into government, you should not be complaining. You look at what has been done, you look at the flaws of what the previous government had done, you improve it. You build, you keep on building upon it. And I think it's very difficult to be able to meet everybody's requirements all the time. Something that's very difficult to be able to achieve. And you will know that too, even from radio. You'll understand how people are reacting to these things.
The Deputy Prime Minister, Professor Biman Prasad, always says that the dilapidated infrastructure was left by the previous government. Yeah. Your government.
That's what he always says. He's got nothing
else. And you always say that is just a whole lot of hogwash. What do you have to say to the people?
I tell him that's a whole lot of hogwash. He should look at the amount of investment in. It's very easy just to say things without looking at the facts and figures, looking at the kilometers of roads, looking at the number of operating theaters that were done, the number of water projects that were done, the number of new connections that were done in terms of water, the number of people that the number of roads that went up, for instance, to the interior of Netasiri and Namosi, and places where the electricity poles didn't go before. You can quantify all those things and see the investment that was done.
You're about to go set up a new party. There's still shortage of beds, shortage of medicine, shortage of basic equipment. What will you do? What can be done?
I think we will have to, at the moment,
It's not a quick fix, as you said.
Not a quick fix. Absolutely, it's not a quick fix. One of the good things that we've had in Fiji is that the Australian government has been supporting the health sector, for instance, in getting systems and processes right. That's what you need to do. If you have the right systems and processes, they will help you to be able to address the problem. You need to have good plans. You also have to have good people to run it. This is a very important thing, good people. And in order to do that, your systems for getting good people in place must be, based on merit. If you're going to have systems that deviate from the use of merit as a way of getting the right people on board, you're going to keep having the problems over and over again. But then you need long-term solutions. That's why the 2050 water strategy, strategic development plans over 10, 15 years or 5 years are good because it helps you to map out systems for the future.
The strategy is as good as measuring its deliverables. Do you think that should be done a more microscopic way?
What do you mean?
Deliverables. You can have a good strategic plan, but you need to measure the deliverables at the end of the day.
Yeah. For every strategic plan, you have to have your targets, and you have to have the indicators of how well you performed in each of those areas. Then you measure your indicators. You can have a problem if you use the wrong indicator, which is, I think, I've mentioned for this current strategic development plan. When we talked about it, there was a workshop at USP. I pointed out that in some of those areas, you look at what is written in the strategic plan about one particular sector, huge thing. When you look at the indicators, sometimes there's a mismatch between what they're measuring as a measure of performance and what it is they're trying to improve. And of course, when you're going to, the people that are going to work that plan, they'll focus on what's in the indicator. They'll focus on meeting what is required to make that indicator successful, achieve the targets in that indicator. But if the indicator itself is not a good reflection of what you're trying to do, then you're working on the wrong thing. You get what I'm talking about?
I do get that, yes.
Yeah. So
I just want things to work so that the people can get the service they want.
Yeah, all of us want that.
That's right. Now, critics have pointed out that ministers often went overseas for treatment, while ordinary Fijians had no choice but to queue up at hospitals with lack of special treatment, lack of beds, lack of medicine. Do you see that as a failure of leadership and forward planning?
Yeah, well, I think all of us would like as many of our people as possible to be able to access that tertiary care, that more specialized sort of work in programs in Fiji at low charge, and I think that's what Aspen was supposed to do, or is supposed to be providing for us. On the other hand, if people have the resources, they are at liberty to go overseas. But the flip side of that, of course, are local people that don't have the resources cannot be able to access the kind of service. All of us in this country, and I think for the health sector in particular, it's the sector as a whole, the development of the private hospitals and the level of care that they can provide here in Suva and Nandi, it's improved over time. You've got to have a plan that makes the whole sector improve. At the moment, you have, let's say, private hospital, these other ones up and down the road there, so that whole sector is beginning to improve. And when that sector improves also, it gives us ability to get into these retirement homes. When people retire, when you build retirement homes, they need access to good hospitals. So the development of that sector is not something that's going to happen overnight. I'm glad to see the developments they're talking about now. I think there's one specialty hospital that the Indian government is looking to build.
In Nasino.
And there's, I think there's talk about Valelevu Health Center. There's talk about a few others. I think I can't get it on by. So you need to have that phased approach to be able to...
As long as there's coverage for all, because not everybody can go to the private hospitals.
Of course. Yeah, and I think the level of service, the kind of thing that they talked about at Aspen, for some of those things to be available to locals. Means testing, that means that those that have less money, they get it for free. I'm not sure how well that is working.